We definitely want to address the state of the world today and answer a couple important FAQs about the coronavirus. All right, so hi to everyone watching. My name is Brittany. I am the digital marketing manager here at 11 Health. For those who don't know of us, we create solutions for those who have IBD, colorectal cancer, those who currently have an ostomy or preparing to undergo major digestive surgery. So if this describes you, I definitely encourage you to head over to 11health.com to find out more about our products and our services. Today, we're going to welcome our clinical director and lead of our innovation, Dr. Saahil Mehta. So thank you so much for being here, Dr. Saahil.
No problem, absolute pleasure.
Today, we're going to be talking about all things remote patient monitoring and telehealth. So that's definitely going to be the focus of today's webinar. Let's get started. So from your perspective, Dr. Saahil, who is considered high risk?
Well, that's a really good question because, fundamentally, we're all at risk of getting this virus, and the people that really are at high risk are those with either underlying health conditions, so that can be high blood pressure or asthma, so lung diseases, or even heart diseases as well. And those who are older, so people who are above 65. It's interesting, different countries have different ages, but the general age is about 65. And the other big underlying condition is diabetes, so not to forget that one as well. But what's really interesting is that everyone reacts differently to this disease at the moment, so we're learning as we go along.
That's definitely true, and definitely important to point out that we're still all in a state of learning each and every day. So from your perspective and from your research and what you've heard and seen in the medical field, what are some of the major symptoms of COVID-19 that people should be on the lookout for?
So that's a really good question too. The symptoms change as well daily, but the kind of common things that people see are high fever and tiredness. Some people have reported headaches, but not everybody. A lot of people have reported dry cough, and then in severe cases, people have reported breathing difficulties as well. But you have to remember that some people have very, very mild symptoms, and some even have no symptoms at all. So you can even have the disease and not notice a thing.
Yeah, that's huge. And we've been hearing a lot of that lately, that, people are testing positive who haven't shown any signs or symptoms that have been describing in the media. So then at that point, then what can people do to kind of help reduce their risk and protect their families and protect the general community?
Yeah, that's an easy answer as well. Everyone has to follow government advice and doctor's advice, which is stay at home. Certain countries like Italy, the situation over there is catastrophic. They're losing almost 1,000 people a day, people who are dying of this. That's like a small village, and we all just have to follow the stay-at-home rules. We have to only go out for essential purposes, like going to the pharmacy or going to the supermarket. It's really important to wash your hands, and there's never been a better time to learn how to wash your hands. And you can find a little video that I did with my daughter about that on our website. And wear protective masks if you can get hold of them. But remember, the evidence on whether they help is changing all the time as well. No one would definitely say they work, and really we have to prioritize mask wearing for the people who are on the front line at the moment. The healthcare workers who are dealing with this. But the other thing to say is that just use common sense. If you're going to go out, and you must practice your social distancing. Some of the supermarkets have done really well, and they've put actual red crosses on where you can stand at the checkout. None of us, even 3 weeks ago, would have thought that would ever have happened. That's the only thing you see in movies, but really, we've got to take it all seriously.
Definitely. Definitely, those are amazing points. And from our perspective here at 11 Health, we are supporting chronically ill patients, those who are considered, high risk. So, what are some ways that you think those patients can still seek the very necessary medical care that they receive on a weekly basis during this time when they're really told to not leave the house?
Yeah, I mean, that's really hard to do. One of the things that's coming out of this crisis is the role of technology in healthcare and how it can essentially support and run telehealth. And telehealth's a really big thing. Essentially, what that is that you, as a patient or as a healthcare user, can access all of your appointments and contact your doctors and nurses online without having to go to a hospital. So I think, one of the things that this crisis is demonstrating is how much we can actually do online. And one of the other concerns I have at the moment is this whole stay-at-home policy is great at keeping the virus at bay. However, if you live on your own, it must be incredibly isolating. So there's two things that I'm worried about. It's not just the physical health, it's the mental health of patients as well that's difficult to manage at this point. And this is where telehealth can really help. If you can have contact with somebody, another human being, another healthcare professional through the medium of telehealth, and actually that's a really good way of staying fit and healthy during this time.
So from your perspective, then you personally, both as an individual in this world and as a clinician, believe that telehealth is important then?
Yeah, hugely. I mean, look, we're going to get through this as a human kind, right? But it's really important to remember, like, going on from this, we can use telehealth to really support healthcare systems in the future. If you think about it, even if you were to move 1% of all outpatient appointments to telehealth, we would be able to prevent unnecessary visits to the hospital. Why should you have to take half a day off to go and see your doctor when you can do your appointment, if it's appropriate, over the phone, over video conferencing, really. And there's every reason to think that that's an entirely safe and reasonable way of doing this. And we're at 11 Health, that's one of our main core offerings, and we do that in the form of SmartCare.
Definitely. That's a great segue into kind of telling us a little bit about how SmartCare works.
Yeah, sure. So basically, SmartCare is a whole ecosystem of allowing a patient to be monitored at home through an app and also through our hardware devices if you are an ostomy patient, and connect all of that through technology to a human, a patient coach. Now, patient coaches aren't doctors, they're not nurses, they are trained individuals who have direct experience of healthcare, either as a patient or have been close to patients in some form or another. And SmartCare connects all of that together. So what we have at 11 Health, which is Alfred SmartCare, is really a very sophisticated platform to monitor and take care of patients remotely.
That's awesome. And so that's great, Dr. Saahil. Thank you so much for your time today and for taking the time to talk to us a little bit about how SmartCare works. For everyone interested in finding out more about SmartCare and to receive a free 12-week trial that we're currently offering of SmartCare, I encourage you to head over to 11health.com/remote-patient-monitoring to sign up for SmartCare today. Thank you guys so much. Thanks, Saahil.
Thank you.